Hi, my name is Alex Rains, and today we are talking about utilizing self care to address grief and loss, leading to burnout among social service and behavioral health care providers. So, we're going to talk about burnout, we're going to talk about how that relates to self care, whether or not that does anything, and then we're going to talk specifically about self care relating to grief and loss. Um, Now, this is something that is very near and dear to me. I 100% had this happen to a coworker of mine who had a client pass away, and they quit shortly thereafter. And I am convinced those things are connected. Um, I also had a situation where I had a coworker pass away, and that should have been, I feel like, a lot more traumatizing. But me and my other coworkers who knew him were able to kind of gather together and bond over that event. So I wanted to get to the bottom of why that was, why we had those two very different experiences. A couple of quick things before we get started. There are a couple of uncredited photographs, charts, graphs, that kind of thing, in here. That is something that I tried to put in the references, which are not in MLA format. So hopefully, were I to try to publish this somewhere publicly, or certainly before I try to turn it in, get those fixed. Anyway, so social service providers, and this is something I think that goes unacknowledged a lot. Behavioral healthcare practitioners. They work in a culture of one-way caring, in which they are required to demonstrate empathy, compassion, patience, without the expectation of receiving such care in return from their clients. To be effective, they must maintain appropriate boundaries and levels of emotional or psychological involvement, which can be really hard. And establishing and maintaining these one-way working relationship takes effort and energy, which again often does not get acknowledged, which places these practitioners at increased risk for negative outcomes like stress, professional impairment, and burnout specifically. Ironically, while helping clients move towards well-being, practitioners often can overlook their own needs and indeed may not have learned how to take the time to care and nourish themselves, having been trained to believe that this would be selfish. So, what is burnout? So, burnout relates specifically to the workplace. It is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. It is characterized by three dimensions: a feeling of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, or reduced professional efficacy. Burnout refers specifically to phenomena in occupational context and should not be applied to describe experiences in other areas of life. So just giving us some definitions here so we know what we're talking about. Burnout rates. Okay, so these are estimates, but at the very least here, over and over again, it has been found that over 50% of behavioral health providers report experiencing symptoms of burnout, the things we just described. The rate of burnout will likely increase given the continued growth in the number of people seeking behavioral health care, along with behavioral health staffing and retention challenges. And anyone who is in the field right now will feel this. You know what this is talking about. Burnout can have lasting harmful effects on a provider's physical and mental health, including but not limited to insomnia, hypertension, depression, anxiety, and substance use. So this is bad. This can really mess people up for a long time. And ultimately, it's bad for the workforce because they're more likely to become disengaged from their jobs and leave their positions. The three dimensions of burnout over here. So sustained feelings of exhaustion, depersonalization, and professional inefficiency. So it makes you bad at your job. But then look, it's not just grief and loss, right? Like there are a lot of things to contribute to burnout. And I want to make that clear that a big number of the things that are super important contributing factors here, they cannot be changed. There are a lot of systemic causes of burnout, some of which you can look up and advocate for in your own workplace. But that is not what we are here to talk about today. We're looking at all these different things. This poor little guy here. Limitations from state regulations, lack of leadership support, limited flexibility, autonomy and voice, politicization of science and public health, mental health stigma, all kinds of different stuff, right? Leading to, again, workforce retention problems, and ultimately really serious medical complications potentially for the people trying to help. So what can we do about this? Well, first off, we want to make sure that what we're talking about is burnout and not some of these other things here, which can easily be confused with burnout and be contributing factors: compassion fatigue, vicarious trauma, secondhand victim syndrome. But burnout specifically, we were just talking about these collection of symptoms. So there are two ways to address them, as I alluded to earlier. And the vast majority of these things, I want to make clear, are going to be on the left. They are organizational level strategies that you, as a direct service provider, very likely will not have the ability to implement, at least in the moment when you need it. So, instead of organizational interventions, we are going to be looking at what you might call individual level strategies, aka self-care. So what is self-care? So one way of defining it is simply to say that it's attending to one's own holistic well-being, whatever you need to make yourself better. But more specifically in this context, the actions that individuals take to enhance, restore, or maintain health, prevent or limit illness, and preserve self. And that's another thing I want to make clear here. Self-care in the medical context is very different from what we are talking about here. We are not talking about self-care for a diabetes patient. We are not talking about self-care for someone with a heart condition. We are talking about self-care for behavioral health providers to reduce instances of burnout. So, in that context, we might define self-care as the ability to refill and refuel oneself in healthy ways, including engagement in behaviors that maintain and promote physical and emotional well-being, as well as lessen the amount of stress, anxiety, or emotional reaction experienced when working with clients. So again, taking care of yourself can cause you to have less of a reaction in the moment to your clients, which will then have a greater long-term impact on your health. At least that's the theory. So now the question here is, does it work? And the answer is yes. There's a lot of people out there that work in really difficult industries, especially in health. There are, pediatric oncologists out there. There are people who work with grieving parents. There are people that work in hospice for years and years, become known as hospice angels because they stay in the industry for so long. So the question is, how do they do that? Well, there is substantial support for the beneficial effects of self-care practice in the reduction of negative outcomes, such as burnout. So there you go right there. It does work. All the studies say so. Engagement in self-care is associated with greater well-being, lower levels of stress and negative affect, higher levels of positive affect, flourishing, self-related, academic, and clinical performance, self-rated, compassion, satisfaction, quality of life. So all that good stuff, right? We want out of life. And then a lack of self-care, so the opposite, is actually related to higher levels of secondary trauma and a greater risk of health status decline and ultimately burnout. So that's bad. We want to avoid that. So how do we do that? Okay, so individual level strategies encompass much of what we traditionally think of as self-care. So these are broad strategies here. These are ideas. This is a worksheet. These are here to try to help you make a plan. So this strategy here for addressing self-care is for people who are planners, who like to think ahead. But this is important because it is very, very difficult to address one's own mental health when you are inside of a crisis. This is literally the basis of modern behavioral health care. And so if we turn this around and apply it to ourselves, well, what that looks like is making a plan, listing out the things that you're going to do in order to maintain your self-care. So we have things like practice gratitude, right? But also contribute to causes that they believe in. Take breaks for spiritual practice. Those are all, things that people might neglect. Things like creating a budget, talking to partners about financial goals. These are long-term things you might not necessarily relate to stress and burnout, but which are always in the background while you're trying to take care of these workplace or professional needs, some of which you might be able to change, like making times for breaks, taking time with colleagues. Others you might not, such as using the benefits provided in your workplace. You may or may not be eligible. But all these things, these are just ideas. These are for someone to sit down and make a plan, a self-care plan. Here's some more ideas here. Here is just a further kind of overview of things that are good and things that are bad, things that work and things that don't. A lot of them seem very basic, like getting a healthy amount of sleep, eating a healthy diet, exercising regularly. But as many of you may know, when you are experiencing burnout, stress, or secondhand trauma at work, things are very easy to neglect. This is why we create a written plan ahead of time. Okay, so let's say that we have our written plan and we're done. Or we are simply too stressed out in the moment to create this plan. We are so close to burnout, we can't look forward into the future. This does not apply. We need something now. Okay, so this is where we're going to start looking at a second strategy here. These are things that you can do right now in the moment to help decrease burnout and ultimately the long-term effects of trauma. So when the brain is in a reactive state, higher functions tend to be significantly reduced or even go offline altogether. See this in clients all the time. Call it flipping your lid, but it happens in small doses. Crises do not happen all at once. They have accelerating stages, and so for a professional, this might look like trouble concentrating, inability to maintain focus, hard time prioritizing tasks, simply feeling irritable, short-term memory difficulties, or social engagement. You might find yourself forgetting things, having a hard time concentrating, and really not wanting to spend time around other people. These are all signs that you are experiencing trauma at work, but there are things that we can do. And so once we realize what's happening, we can take a step back here and we can try some things. So these are basic mindfulness exercises. These work for anybody, but specifically for people to use in the moment when they are experiencing trauma to bring them back down. 5, 4, 3, 2, 1. That's a good one. You know, listen for 5 things you can listen. You smell for 4 things you can smell. You look for 3 things that you can see. You touch 2 things you can touch, and you taste 1 thing you can taste. Change the numbers or the order around. Moving the body, that's super important. Not for the intention of getting a workout in, but literally circulating the bloodstream, taking those stress hormones and causing your blood to filter them by pumping your heart. Breathing, lots and lots of breathing techniques out there. In through the nose, out through the mouth. Try counting to 7 each breath. 1, 2, 3, 4, 5, 6, 7. You can also utilize technology. Lots of meditation apps out there, lots of good things on YouTube, lots of ideas. So things that you can bring up in the moment that you know work for you. You can prepare these ahead of time and have them on your smartphone. And finally, hydrate. A decrease in hydration by as little as 2% has been demonstrated to negatively impact cognition and mood. We are mostly water. Our brains need water. We do not get enough water, typically, or at least I don't. So these are all things to try. Okay, now specifically, I want to look here at grief and loss. Now this all come from people that are in the bereavement profession. They work with people that are dying. And so how do you do that? How do you maintain a life outside of that? Well, here are some tips. So finding time for solitude and closure after each day's work. Caring for your body with good nutrition, exercise, and sleep. Engaging in intentional spiritual practices each day. These are for people who have those in their lives, obviously. But also buying a plant or a picture to make your office space nurturing. Put life around you that's growing. Take advantage of professional therapists. Some people this works for, some people it doesn't. Some people like talk therapy, some people find benefits from medications. There's lots of different kinds of professional therapy out there. Don't just bounce off the first one if it doesn't work for you. Try somebody else. Their style might be better, or it might click. Make sure to balance work time with pleasure time. Join a spiritually focused community. So making time for yourself and your other needs. And then cultivate relationships with colleagues. So again, friendships, connecting with other people, finding community. This here, practitioners of CBT might recognize this does not work for everything, but it may work for some things. Strong feelings and thoughts are common following sudden loss, especially when a person is overwhelmed or trying to regain control. And it's easy to get stuck in beliefs that may fit most of the time, but let's say they don't serve all of the time. So, what you can do is when you find yourself having those thoughts, you can see if they can be reframed. Something like, I will always feel this awful, can become something like, I often feel this awful, but over time, it might just be sometimes. Or there are people I can talk to who make me feel better. I should have done something to prevent this, can become something like, I did the best I could under the circumstances with what I knew at the time. And it should have been me, can become something like, all I can do now is live in the present moment as it is, or that choice belongs to a higher power. Again, this is specifically for grief and loss here, but I do think it can be applied to any scenario where you are experiencing that. If we've learned nothing else in this class, grief and loss come in many, many different forms, some of which we may recognize and legitimize, and some of which we may not. But these are all things that we can do in the moment to help ourselves to get through. Everything from breaking tasks down into smaller, more manageable pieces, to thinking about smaller segments of time. Tell yourself you only have to make it through lunchtime. Or I have met people who tell themselves they only have to make it through the next 20 seconds. And then the next 20 seconds after that. Other things, tell someone you love them. Spend time with a pet. Make a list of what you feel guilty about. Consider where you can make amends and acknowledge when you are powerless to change. Just lots and lots of stuff here. All of it is not going to work for everyone. Some of it may work for you. Try things, like always in the social work position. See what works. Additional resources here. This is all stuff that people can find more ways of coping with grief and loss, more ways of committing to self-care. There's modules here, there's YouTube videos, there's journals dedicated to this stuff that you can read. Yeah. So the big thing, just take care of yourself out there. And if you can, try and find time in your life to commit to some of these extreme self-care techniques when and if you need them. And make sure that you are willing to admit to yourself that this is important. Thanks, everybody. Take care out there.